Good day, everyone. I am your lecturer, Ma'am 𝓝𝓚103𝓐 and welcome to your first lecture discussion on fundamentals of nursing. For today, we'll be discussing health, wellness, and illness. Health, wellness, and illness have a lot of definitions and interpretations. And as a future nurse, you should be familiar with these different concepts and consider how these concepts may be individualized to a specific client of your own. You know, when we care for patients, we have to pay attention to the different factors that might affect how they will take up our plan of care. So the plan of care has to be age-specific, case-specific, so that we can provide holistic nursing care. Now, our aim for today's discussion are as follows. Number one is to differentiate health, wellness, and illness, compare the various models of health, identify factors affecting health, status, beliefs, and practices, describe the different dimensions of wellness, define illness, and how a patient might adjust to the different illnesses that they have. So before we start discussing health, let me ask you, what is your own definition of health? What's your personal definition? So why am I asking this? Because for most people, or the general population would say, being healthy means you do not have any signs and symptoms of diseases. And usually, being healthy means you are not experiencing any pain at all. So another usual definition of people when asked what is health for them is that they would say that they are active and they can do what they want or what they must do. Some people might say being healthy would mean being in good spirit most of the time, meaning they do have a very positive outlook at present, which means or which tells you that they are healthy. So for most people, these are their definition of health. So I think some of you might say some things that are same as what I had mentioned above. So let's go over the different definition of health based on several resources that I had gathered. So the traditional definition, as I mentioned, if I am sick, then I'm not healthy. Or the other way around, if I am not sick, then I am healthy. So that's the definition of the traditional definition of health. Another one, if you take a look into consideration the definition of Florence Nightingale, so according to her, it is a state of well-being and using every power the individual has to the fullest extent. Okay, so for her, for Florence, it is a highly subjective state wherein if a person has the capacity to use all his strength to perform day-to-day activities, then he is healthy. Another definition, according to the American Nurses Association, health is a developmental and behavioral potential that is realized to the fullest extent. So basically, it's more of like synonymous to what Florence had mentioned. Another definition, according to the World Health Organization, health is the complete physical, mental, social well-being and not merely the absence of disease or infirmity. So such definition tells us that health is a holistic combination of the different dimensions of wellness of a person, whether that be physical, mental, social, and not just merely saying, may sakit ako. So there is no consensus or generally an agreement about how do we define health. There is knowledge on how to attain it, how to reach the fullest extent of health, a certain level of health, but health itself cannot be measured directly. Moving forward, another definition is discussed by Walter Kannat. He says that being healthy means your body has the ability to maintain homeostasis. Okay, so what does homeostasis mean? No? Reviewing your anatomy and physiology, this term pertains to the ability to maintain a specific point of balance within the physiologic processes of your body system. So how do we explain this? So if a person's body system experiences a particular change in its processes, or is exposed to stress, or any injury, your body would perform necessary compensatory mechanism. For example, you are having difficulty of breathing. So if you are having difficulty of breathing, most of the time, the client would experience faster breathing. So nahihirapan ka huminga. So the tendency would be to exert extra effort to breathe. So if this compensatory mechanism is adequate, then your body would adapt. Now, if this compensatory mechanism is inadequate, that particular body part, whether that be a cell or an organ, would undergo pathophysiological mechanism and that could lead to a disease. Like say for example, the stress would be poor blood circulating oxygen, as I had mentioned a while ago, that you are having difficulty of breathing. Now, so how does your body obtain oxygen in the first place? Diba? Through breathing process or through inhalation. So if your body has below normal oxygen, such scenario would send signal to your brain, no? To your respiratory center. And then your brain would send an instruction to your respiratory center, okay, please increase your breathing kasi kulang yung nagsisirculate na oxygen. That is why a person would experience faster breathing, or we call that tachypnea. Now, if this is adequate, then your whole body would adjust and adapt. Meaning, if such faster breathing would gather enough oxygen to supply the needs of your body, then your body will adjust. If not, then you will experience a different problem related to poor oxygenation. Like, there are instances that your skin becomes bluish. We call that cyanosis. In some instances, your skin would look very pale. That's pallor. Okay? So these are some indications that you do have poor blood circulating oxygen. So that's how we describe homeostasis. So, to give another set of example, you have here the stimulus or the stress is your blood sugar level. Now, if you can see here, there is a scale, a balance. Okay? So if by chance, this blood glucose level is above normal level, or there is rising blood glucose level, it would send signal to your brain, and then your brain would instruct your liver to perform glycogenesis. So what happens during glycogenesis? So glucose molecules are added together with glycogen so that it can be stored in the liver, so that by the time that you would need them, they are ready to be released. So in short, when we say glycogenesis, okay, it's a process of storing excess glucose in your body. Okay, on the other side of the scale, if by chance your body encounters decreasing or falling blood glucose level, there are two ways on how the body can adapt to the stimuli. So the first path, okay, the first path would tell you, di ba nag-store tayo ng glucose nung maraming supply sa katawan natin? Now, yung supply na to na nakastore, i-release natin siya kasi bumabagsak yung ating blood sugar level. So the liver will then be stimulated to convert glycogen back into glucose, and then this will be released into your bloodstream. Okay. So every time you see the word lysis, this refers to breaking down or destruction of an outer membrane in order to release a specific substance. In this case, we have glucose. Okay, but ma'am, could it happen that there are no stored glucose? Yes, no, that's highly possible. So what will be the second compensatory mechanism if there are no stored blood sugar? Okay, this is now called gluconeogenesis. Gluco meaning glucose, neo meaning new, and genesis meaning to start or to create. So technically speaking, by definition, no, gluconeogenesis refers to create glucose from sources other than glycogen. So how is that done? Excuse me. Because of the presence of amino acids and fats, okay, other sources of glucose is through the utilization of proteins and fats. This will now be converted into glucose, and this glucose is released to your bloodstream. So these are the two ways on how your body adapts to decreasing blood sugar level. Okay, we all know, no, that glucose is our body's food. Okay, so the availability of glucose in our bloodstream is necessary so that it can be used by our cell, no, to produce ATP, or your adenosine triphosphate, that of which in layman's term, energy. Okay, another very good example excuse me, that we can cite, you consider the different concepts, no, again, learned from your anatomy and physiology, is how the blood pressure is being maintained in our body. Okay. This process is called, or this entire system of regulating your blood pressure in your body is called your renin-angiotensin-aldosterone system, or what do we call RAAS. Okay. So, if your body has decreased blood pressure, it allows a negative feedback. Negative feedback meaning from an initial state, no, we would go back to the opposite of the reaction of the stimuli. Like say, for example, there is decreased blood pressure. If your body would adjust, if your body would adapt, it would undergo your negative feedback mechanism, or generally speaking, your homeostasis. How do they process the balance? Okay. Now, the output, if there is a working negative feedback mechanism, the output would be the inverse or the opposite of the stimuli. So if there is decreased blood pressure as your stimuli, the outcome would be an increased blood pressure. Okay. Now, our initial stimulus here could either be low blood volume, BV, or low blood pressure. Now, one thing to understand is whenever the blood volume is low, that always means we also have low blood pressure. So these two things, blood volume and blood pressure, are always proportional to one another. If blood volume is high, then blood pressure is also high. Okay, but our initial stimulus here, given on our example, okay, is that there could be instances when a body experiences low blood volume. Okay, maybe because of severe dehydration, like during summer, no, and we haven't consumed any fluids, or maybe after a strenuous exercise and you haven't replenished your fluids. Okay, we could also have sodium deficiency together with water deficiency in our body. So remember, no, water follows salt. Okay, kung nasan si salt, sumusunod sa kanya si water. Okay, so we could remember, no, that where there is water, there is also salt. So if we have low sodium level, we also have low water content in our body. Or another instance where there is blood volume decrease, no? Like say, for example, there could be, or a client may have experienced a bleeding episode, okay, where hemorrhage and losing blood is the primary manifestation. Like say, for example, the client experienced a vehicular accident, okay, and then there was extreme loss of blood, okay. So whenever we have decreased blood volume, that's automatically going to mean we have decreased blood pressure. So these two always go together. Now, within your kidneys, no, we have a cluster of cells, no, referred to as your juxtaglomerular apparatus. Okay, so within that apparatus, inside are what we call your juxtaglomerular cells, or often called JG cells for short. No? Now, when these JG cells senses that there is a decrease in blood pressure, they release an enzyme into your blood called renin. Okay, now as your blood passes through your liver, okay, and it senses, the liver senses that there is a decrease in blood pressure, the liver will release a protein called angiotensinogen. Okay, so angiotensinogen is a special protein manufactured by the liver in response to a sensation of decrease in blood pressure. Okay, but this angiotensinogen is an inactivate protein. It can't work alone. Okay, so when you see a suffix, every time you see a suffix imogen or ogen, okay, it tells you, or it implies that this protein is in an inactivate form. So it can't do anything yet. It needed something to combine with so that it can be useful. Okay, and what is that something that combines with angiotensinogen is your renin. Okay, so once they combine, okay, it will stimulate the conversion of angiotensinogen 1. Okay, so your angiotensin 1 came from the activation of your angiotensinogen brought about by mixing with renin. Okay, now, eventually, your blood will reach your lungs. Okay, is angiotensin 1 already useful? Not yet. Okay, so to make it useful, okay, your blood would pass through your lung, definitely, no, generally speaking, through oxygenation, no, to replenish your blood with oxygen. Now, once your brain senses that there is a decrease in blood pressure, okay, the lungs now would release an enzyme called your ACE. Okay, ACE stands for angiotensin converting enzyme. Okay, so angiotensin converting enzyme would act on your angiotensin 1 and would convert it into angiotensin 2. Okay, now, magagamit na ba natin siya? Yes, because angiotensin 2 is the active or the mature form of angiotensin. Okay, so angiotensin 2 is a hormone that is going to have several functions coming over from here. Okay, so So let us start with the first function of your angiotensin II. So one of the function is to act directly on your adrenal gland. Okay? So on your adrenal gland, the outer covering, okay, is your adrenal cortex. Okay? In the middle, by reviewing anatomy, is your adrenal medulla. Okay. Now, so what happens if it acts on the adrenal cortex? Okay. Now, your adrenal cortex would or does releases a lot of hormones. And one of the most important hormone released by your adrenal cortex is your aldosterone. Okay. So your aldosterone now has an effect, okay, has an effect directly on the kidneys, especially on the distal convoluted tubules, okay? So your aldosterone facilitates the reabsorption of sodium and water into your blood, okay? Remember, our key again, where there is sodium, there is water. So from your blood, it would filter back water and sodium, returning to your blood, and then the excess would then be forwarded and urine will be formed. Okay. Now, so as mentioned, aldosterone is necessary so that sodium and water is reabsorbed. Okay. Now, what's going to happen with the amount of water reabsorption? So the more water reabsorbed into the your blood, the more water reabsorbed into the blood, there is a greater blood volume. So the more nahilahin natin pabalik si tubig, the more na mas dadami yung ating blood. Okay? And what do we say when there is greater blood volume? It also synonymously says that there is greater blood pressure. So our initial stimulus of decreased blood volume and blood pressure will now be brought back to an increase in blood pressure. Okay. Now, going back to angiotensin II, okay, this hormone has another function which is actually able to do vasoconstriction. Okay, so your angiotensin II has a direct effect on your blood vessel. Okay, so basically to constrict, to narrow down your blood vessel because there is decreased blood pressure. So what does it do? Directly on your blood vessel to constrict them. Okay, and so angiotensin II will be able to act directly on the arterioles that lead to capillary beds, causing vasoconstriction. So if there is vasoconstriction that narrow down yung ating blood pressure at blood vessel, this now causes your blood pressure to increase. Okay, so not only can aldosterone independently of angiotensin II increase in blood pressure, angiotensin II also has a direct effect on your blood vessel to constrict them, thereby causing an increase in blood pressure. Okay, so that is how we simply describe how our body adapts to a decreasing blood volume or a decrease in your blood pressure. Okay, so much for the homeostasis part. So I believe I had already made it clear how our body adapts to the different changes in our external and internal environment. Okay, so again, maybe we can agree that being healthy also means that your body has the ability to maintain internal homeostasis or maintain balance. Okay. Now, moving forward, given the complexity itself of defining health, several personalities have defined different models of health in an attempt to bridge the connection between health and illness. Now, let us proceed with the different models of health. Okay. Several models of health were developed, including that of Smith's model of health. So under Smith, we have 4 models. We'll discuss them one by one. You have Cleveland-Clark's Eisenhower's environment model, the health-illness continuum, the health-belief model, and your Maslow's hierarchy of needs. Okay. Let us proceed with discussing Smith's models of health. So under Smith, he has a lot of different models. Number 1, there is the clinical model. So the clinical model provides a very narrow interpretation of health. No? On the clinical model, people are viewed or perceived to be as physiologic system. Physiologic system meaning they are made up of organ system, organs, tissues, and cells, and even biomolecules that work together to accomplish the complex task of sustaining life on a day-to-day basis. So according to the according to the clinical model of Smith, health is identified by the absence of signs and symptoms of disease or injury. Meaning to say, if a person is not experiencing any signs and symptoms of any problem at all, then that person is healthy. Okay? So generally speaking, it is a state of not being sick. Wala kang sakit. Okay? And its opposite is disease or injury. Okay? So, when one of the parts of the body system is not functioning properly, then a person may experience symptoms of disease. Okay? So, medical practitioners uses the clinical model in their focus on providing the relief of the signs and symptoms caused by diseases and to eliminate them generally. Okay? And most common than not, pain. Okay? So, when these signs and symptoms are no longer present, then the medical practitioner considers the individual's health to be resolved. Okay? So, kung nawala na yung mga signs and symptoms, then a person is already healthy according to the clinical model. Okay? Next, role performance model. So, according to role performance model, it has, if a person has the ability to fulfill his or her role, societal role, then even if the client is clinically diagnosed of a particular disease, if he can perform his or her role, then he is considered healthy. Okay? So sickness in the role performance model is the inability to perform one's role. Okay? So people who can fulfill their roles are generally healthy even if they appear clinically ill. For example, a man who works expectedly, or what is expected of him, even though his X-ray film shows that there is maybe a tumor in his lung, then that person is still healthy. Okay? So the problem with this model is that it has the assumption that the most important role of a person is that of the work role. But in fact, no, people usually fill in several roles, like that of the role of a mother, a daughter, a friend, okay? And certain individuals may consider non-work roles generally paramount or necessary in their day-to-day living, okay? Next, the adaptive model. So according to the adaptive model, disease is a failure in adaptation, or generally speaking, maladaptation, okay? So going back to our homeostasis, the adaptive model is generally the description or is based on homeostasis. So extreme good health is flexible adaptation to the environment. Okay, so and the focus of this model is stability. Okay, so meaning if by chance you encounter stress or injury, if your body adjusts to these stressors, okay, then a person is healthy. Okay, then you have the demonistic model. Okay, so this model is a comprehensive type or a comprehensive view on health. Okay, so the condition of actualization or realization of a person's potential is the goal of this model. Okay, and if a person is ill, then that prevents a person from self-actualization. Okay, so what do we mean when we say actualization? No, this is generally speaking, you have reached already your fullest potential in life. Okay, so the realization of human potential is through the combined efforts of a goal-directed behavior, a competent self-care, and the development of a satisfying relationship. So that is according to the eudaimonistic model. Okay. Next, 𝓝𝓾𝓷𝓭𝓪𝓶 𝓕𝓾𝓷𝓭𝓪𝓶 model, or the ecologic model. Okay. So here you would see that there are three circles, which are joined together by arrows. Okay, and these factors, each circle has individual factors, which constantly interacts with one another. Okay. And when in balance, the health is maintained, and when not in balance, meaning one of its factor doesn't work or doesn't adjust, then a disease occurs. Okay, example. So let us stress what are the components of the agent. Okay, so agent here is any environmental factor or stressor, whether that be chemical, biological, physical, or psychological, okay, that can lead to illness or disease. Like say for example, the lack of essential nutrients taken from or obtained from food, maybe because the patient is having this particular type of diet. Okay, and then let's talk about the host. So the host, okay, or the person itself, who may or may not be at risk for acquiring a disease. Okay, and there are different factors that a person or the host we have to consider on the person or the host that may predispose or would make him at risk for having a disease. Okay, this could be family history. Like say for example, your relatives, your parents has diabetes mellitus, so higher are the chances that you will be developing this disease. Okay, age, and lifestyle habits, no, that influences the person's adjustment to any type of agent or any type of environment that person is exposed to. Okay? And then you have the environment. So, all factors external or outside of the host may or may not predispose the person to develop a disease. Like physical environment. Say, for example, a climate, no? Living conditions, maybe you are in a crowded space. Okay? The economic level, definitely, no? Kasi it matters if you have the ability to prioritize healthcare. Okay? Social environment includes interaction with other people and the different life events that occurs on a person's life. Like, say, for example, the birth of a child, the death of a loved one. Okay? So this model, no, these three circles interacts, and if there is balance between the interaction of these circles or factors, then health is maintained. Okay. Next, we have your health illness continuum. Okay, so the health illness continuum measures a person's perceived level of wellness. Okay, here, health and illness or disease can be viewed as two opposite ends of a health continuum. Two opposite ends. Okay, so composed of two arrows pointing in opposite directions and conjoined at a neutral point. Okay, so there is no distinct boundary across for which people move from health to illness or from illness back to health. Okay, why? Because of certain signs and symptoms of disease or a disability, a person may move back and forth within this continuum even on a day-to-day basis. Okay, so there might be some instances in your life where you woke up maybe at the wrong side of the bed, no? And they just felt the bad vibes for the entire morning. And then when you go to work and you suddenly receive a good news, maybe, let's say for example, you got the promotion that you have been waiting for, and then all of a sudden, no, you felt energized right away and even forgotten the idea that you were not in the right mood when you woke up that morning. Okay, so this model tells us that people have a wide range of health and illness experiences. Okay. Next, we have Rosenstock's health belief model. Okay, so according to the health belief model, it is concerned on how people perceive themselves in relation to their health. Okay, so the different factors that a person can consider first before taking actions to maintaining their health. Like say, for example, ano ba yung mga kinoconsider ng isang tao na essential bago niya i-prioritize yung kanyang health or bago siya magpa-check up? Okay. Number one would be your perceived benefits. So perceived benefits refers to a person's perception of the effectiveness of various actions available to reduce the threat of the illness or to cure the disease. What would it do to me? Diba? So that's the first question. Then you have the perceived barriers. So perceived barriers refers to a person's feelings on the obstacle to perform a recommended action. Okay, what hinders him to perform such action? Maybe expensive medication, dangerous or extreme side effect, or maybe unpleasant effect, let's say for example, chemotherapy. Okay? Time-consuming, bubugol siya ng madami kong oras. Or maybe inconvenient, I have work eh. No? I need to prioritize going to work instead of doing my checkup. Okay. Next you have perceived susceptibility. So perceived susceptibility refers to a person's subjective perception of the risk of acquiring a disease. Ibig sabihin, how does he feel about the idea na parang imposible naman na magkaroon ako ng ganitong sakit. Okay, so the personal vulnerability to an illness or disease. And the perceived severity. So under the perceived severity, this refers to a person's feelings on the seriousness of contracting an illness or disease. Okay? So, to what extent does a person feel na delikado yung sakit niya o delikado yung nararamdaman niya? Like say, pananakit ng ulo. Okay? So, there are wide variation in a person's feelings of severity, and often, a person considers the medical consequences. Like say, for example, is it life-threatening? No? Sobrang painful ng ulo ko to a point na hindi na ako makakilos, wala na akong ibang magawa. Okay? So, how much does it affect your day-to-day living? Okay? The social consequences, like say, for example, if, let's say, a person who has cancer in the middle of deciding, whether he or she would want to undergo chemotherapy, okay, he would consider, are there any person whom he or she can rely on during the therapy, okay, who would work for the family if by chance I would undergo chemotherapy because maybe I have to leave work. Yeah. So these are the things, no, that a person has to consider when they would decide to maybe seek for medical attention in terms of the conditions or the signs and symptoms that they are experiencing. Okay. Next, you have your Maslow's hierarchy of needs. Okay, so according to Maslow's hierarchy of needs, it's a motivational theory in psychology comprising of a 5-tier model of human needs. Okay, so the first 4 levels are often referred to as D needs. Yeah, D. Okay, or deficiency needs. And the top level is known as the growth or being needs, or B needs. Okay, so deficiency, according to Maslow, no, deficiency needs arises due to the deprivation and are said to motivate the people when they are not met. Okay, so you have there your physiologic needs, okay, like food, water, air, sex, okay. Then you have safety needs, okay. Then you have belongingness, love and belongingness, esteem needs, and the top tier would be your self-actualization. Okay. Now, they are called to be motivational theory, no? Because the motivation to fulfill such needs becomes stronger the longer the duration they are denied. So, meaning to say, with basic food, basic needs, for example, the longer a person doesn't have food, the longer the desire, okay, the higher the desire to obtain such particular need, or the more hungry a person becomes. So the longer na wala siyang food, the more hungry they will become. And that would motivate them to get these basic needs. Okay. So that is your Maslow's hierarchy of needs. Okay. Now, let us proceed with health beliefs and practices. But before that, maybe it is necessary to define first what is health status, health belief, and practices, and maybe health behaviors. Okay. So when we say health status, no, this is the state of health of an individual at a given point in time. Okay. Say for example, at present, I am well. Okay. I don't feel any signs and symptoms of diseases. Okay, so that's health status. Now, health belief pertains to the concepts about health that an individual believes that are true, or yung mga tinatawag nating paniniwala. Okay? Let's say for example, kapag daw ang isang tao ay buntis, kapag siya daw ay kumain ng saging na kambal, magkakaroon daw siya ng kambal na anak. Okay, so these are common, no, beliefs that a person holds in their life, maybe because they are passed through generation. Okay, so that is what we mean when we say health beliefs. Then you have health behaviors. Now, health behaviors are actions that people take to understand their state of health, maintain them in order to prevent injury and ailments, and to reach their maximum potential. These behaviors might include, let's say, eating the correct choice of food, exercising, no, paying attention to the signs and symptoms of illness and taking prompt action, following the advice of your physician and the health practitioners, no, avoiding vices like smoking, heavy alcoholic drinking, okay, taking time to have rest and relaxation, maybe with your family, with your loved one, and basically managing your time effectively. So these are all health behaviors. Okay. So since we know the differences of this on these terms, now let us proceed with the different factors affecting health status, beliefs, and practices. Okay. So we group them into two. You have internal factors, that of which present along in the body of that person, and the external factors or outside that of the person. Okay. Now, let's talk about the first internal factor. You have a biologic dimension. So under biologic dimension, it includes your genes, gender, age, developmental level. All of this influence your health as a person. Okay. Genes, let's talk about your genetic makeup, maybe related to your susceptibility to a specific disease, like say, risk to having a particular disease. Like say, for example, cancer runs in the family, or diabetes mellitus runs in your family members, okay? So higher are the chances that you may, or maybe not, maybe, if they perform healthier health behaviors, okay? Or wise health behaviors. So there's a possibility that you would not have this kind of disease. But if it runs in the family, then it can make you at risk for having this, okay? Next, you have gender or sex. Okay? Certain diseases are more common in one gender over the other. Like say for example, common among female is osteoporosis and arthritis, rheumatoid arthritis. While common diseases among male are ulcers, stomach ulcers, abdominal hernia, okay? And respiratory diseases like tuberculosis, yeah. Okay, so these are more common. So there are diseases that are more common when we talk about gender. Okay? Next, you have age. Okay? So distribution of diseases or the prevalence of diseases also varies with age. Like say, for example, certain communicable diseases like whooping cough or measles, okay, are more common in children but are very rare among older adults because maybe you already have developed immunity. Okay? Next, you have developmental level. Okay? Developmental level has a major impact on health status, considering some of these examples maybe, okay? Sorry. So infants may have lack or maybe has an immature physiologic and psychological defenses against diseases. That's why usually children on infancy until 6 years of age has higher risk of having a disease or contracting a disease because of their lower defense mechanism. Okay? Next, you have for toddlers, maybe 1 to 3 years old, since at this age, the kids are starting to walk, becomes very playful with their toys. Okay? So, since they are starting to walk, most common problems are, like say, being prone to fall, okay, and injury than that of older children, okay. Like say, for example, another common problems is the presence of a foreign body in any opening or any opening of the body. Like say, for example, common problems among ENTs in their clinic, no? There will be instances that a kid inserted maybe a bead on his nose, okay, or may naiwang cotton buds sa tenga kasi pinaglaruan niya. Okay, so toddlers are very fond of inserting any small objects in their body parts. Okay, so these are common among toddlers. Adolescent, maybe a common characteristic of adolescent is to try to become independent and to try everything that they wanted to try. Okay, so maybe at this stage, no, adolescents strives to conform or to belong to their peers and are more prone to risk-taking behaviors and subsequently eventually have an effect on their health. Like say, for example, you start to have peers and then the peer that you have at the moment maybe are not that good influence to you. Maybe you wanted to try smoking because your friends are smoking, okay? You wanted to try drinking alcoholic beverages because your friends. Okay, now let's proceed with psychological dimension. So under psychological dimension, okay, this involves emotional responses to stress. Okay, so for example, because you are scheduled to have an examination, prior to the examination, because you are extremely anxious and stressed about it, a person may experience urinary frequency or maybe diarrhea for that case. Okay, next you have cognitive dimension or intellectual factors influencing your health include your lifestyle choices, like say the kind of diet that you conform with. Okay, so these are what we call internal factors affecting your health. Okay, now let us continue with the external factors. Okay, so the first external factor that we consider is your physical environment. So generally speaking, the geographic location, no, for which a person lives in determines the kind of climate and its effects on the health of a person. For example, like say you live in a flood-prone area like that of in Hagonoy. So common diseases that occur at this area are those that are waterborne diseases, food and waterborne diseases like that, diarrhea, dysentery, okay? And then, another example with the, if you live in a tropical country, okay? So, a common kind of diseases present, a common kind of disease present in these tropical countries are like that of dengue on areas where near the mountain or on higher or elevated areas, maybe malaria is a common problem. Okay, so in terms of the kind of environment that the person lives in, definitely it has an effect. Okay, next you have the standards of living. This may include the socioeconomic status and the level of education maybe of a person. Okay, so the amount of income that they have, influences their hygiene, food habits, and their ability to seek healthcare advice, and follow the treatment plan ordered to them. So they vary among high-income families versus that of the low-income families. Why? Because most often than not, those in the low-income families would tend to prioritize the use of their limited finances to obtaining food, to the place they live in, okay, versus that of prioritizing their health. Okay. Next, we have family and cultural beliefs. So different families, most of the time, majority of the families, is that they have a certain pattern of daily living and lifestyles that are passed on to their offspring. For example, maybe a person who grew up in a family filled with violence can be, let's say, abusive of his own family. Okay, there are some cultural beliefs might include those of Asian descent or Asian origin may tend to use herbal medicines, and that of maybe acupuncture and acupressure versus that of the use of synthetically made medications. Okay, and then you have your social support network. So families, your friends, maybe your confidant, okay, and including also your job satisfaction help you avoid illness, okay, or help you adjust to your illness. Okay, so these are the different factors internally and externally that affects a person's health status, beliefs, and practices. Okay. Now, let us talk about factors affecting healthcare adherence. So what do we mean when we say adherence? Okay, so when we say adherence, it is the extent to which an individual's behavior may be, for example, taking medications, following a strict diet, or making lifestyle changes, coincides with medical and health advice. Okay, so the degree of adherence or the degree of following, okay, may range from disregarding every aspect of the recommendation. Maybe there are, like, say, 5 recommendations. So the degree of adherence may vary from not following 5 of them, or maybe I would maybe follow at least 1 or 2 of the recommendations, and the others maybe I do have some certain personal troubles following them. Okay, so there are a lot of reasons maybe why some people adhere or follow a certain regimen or a treatment plan. Okay, and there are also certain reasons why people do not. Okay, so here are the following factors that may affect, okay, the client's adherence to a treatment plan given to them by their health practitioners. Number 1 is client motivation. Okay, so under client motivation, how is the client motivated to work towards the order of the doctor? How willing is he to follow it? Okay, so if the client is highly motivated, then the client can will follow all of the treatment plan advised to him. Okay, the degree of lifestyle change that is necessary. Okay, so it involves changing your daily routines or your pattern of living. Okay, so to what extent can you change yung nakasanayan na? Okay, the perceived severity of the problem. Okay, so a client may assess how severe this problem is on hand, or how much does it affect the day-to-day living of a person. So the more that the person feels that this problem is severe, the higher the chances that the client will follow the treatment given to him by his medical practitioner. Okay, next we have value plays on reducing the threat or illness. Okay, so ano ba yung magiging kapalit nung pagsunod ko? How much do I value, like say, the kind of diet that I am following if the treatment plan requires you to revise the kind of diet that you have? Okay. Okay. So next, let us continue. You have difficulty in understanding and performing the specific expected behavior. Okay. So the level of understanding or the level of knowledge of the patient, has to be considered. Which maybe that's why the reason why he's not following is in the first place, he doesn't understand what is expected of him to do. Okay. Next, you have the degree of inconvenience of the illness itself or of the regimen. Okay. So how hard will it be for the client to follow the regimen? Maybe financially speaking, or the complexity of the needed adjustment. Okay, so this is something that we have to consider. Next, the complexity, side effects, and duration of the proposed therapy. For example, the length of the treatment. Like say, for tuberculosis, if you are diagnosed to have TB, you need to religiously take your medication for an entire 6 months. Okay? So, that is a factor. And then you have specific cultural heritage that may make adherence difficult. Okay? Like say, for example, those who are Jehovah's Witnesses, they do not conform to blood transfusion. Okay? So that would be against their belief. Yeah. Okay. Next, you have the degree of satisfaction and quality and type of relationship with the healthcare practitioner. Okay. So the question here was rapport being established or was established in the first place, the trust, okay? The way the patient are being treated as a person, okay? The way that they were being approached by the health practitioner. So I remember my mother when she was still alive and we were consulting with a particular physician, I remember she would always say, ayoko na bumalik doon kasi lagi na lang niya akong pinagagalitan. Okay? So, it's a factor. Okay? And then, overall cost of the prescribed therapy. So, the financial capability of the client, including the family members, is also considered, okay, or has to be considered. Okay. Now, let us talk about wellness in general. So, what is wellness ba? Okay, and how does it affect the care that we need to provide to our client? Okay, so wellness is an integrated method of functioning, which is oriented towards maximizing the potential of which the individual is capable. Okay. So basically, when we say wellness, there are different things that we have to consider or to look into. Okay, so basically, wellness is a state of well-being. Okay, so it requires that the individual maintain a continuum of balance. Okay, so if you can remember the health illness continuum, there is also what we call illness and wellness continuum. Okay, and to maintain this balance, you need to have a specific direction or a purposeful direction within the environment that the client is functioning. Okay, so ibig sabihin, there are different factors or basic aspects that we need to take into consideration to achieve a certain level of wellness. Okay, number one, there is the responsibility, the ability of the person to do self-care. Right, and what is the goal of the client? Okay, maybe if in the case that he is not well at present, so maybe towards reaching maybe emotional wellness. Okay. So this is a dynamic and a growing process, and it involves daily or day-to-day decision making so that you can achieve your full potential. Okay, so the whole being of the individual is considered. Okay, so it takes into consideration that a person is composed of different components or different dimensions, and that the interaction of these dimensions is highly necessary to achieve functioning. Okay, now, for well-being, as I had mentioned a while ago, if you could remember what we had discussed previously on the previous slides, the health illness continuum. So we also have here the health continuum. Okay, it's a subjective perception of vitality and feeling well. So ibig sabihin, only the person who feels this particular condition or this particular feeling can say that he or she is well or not. So it can be described objectively, meaning, like say I have a fever. at present. So how do you know that you have fever? Maybe you had taken it, you or you had measured your temperature. Okay? Experience, ang init ng pakiramdam ko. Okay? Or ang sakit ng ulo ko. Ang sakit ng kasukasuan ko. Okay? And are measured. Okay? So maybe you had taken or you had your blood extracted and your complete blood count is taken. Okay? And you notice that your WBCs are around 14 counts. Okay? So that may be an indication that you have an infection. Okay? So that is measured. Okay? And then it can be plotted on a continuum. Okay? So it ranges from the highest health potential to death. Okay. So this is what we mean when we say the well-being of a person. It is highly, highly subjective. Okay. So there are different dimensions of wellness as mentioned a while ago. Okay. So these are the dimensions that we can look into when we talk about wellness. Okay. So number one is the physical dimension. Okay. So when we say physical dimension, it talks about your ability. Okay. It talks about your ability to perform your daily tasks. Okay, so it includes maybe physical fitness, maintain your nutritional level, and avoid abuses. So this are, generally speaking, anything that you can see on the superficial. Okay, so that's a dimension of wellness. Okay, and also being able to practice positive lifestyle habits. Okay, so that is the physical dimension of your wellness. Now, let's talk about the social dimension of wellness. Okay, so this pertains to the ability of a person to interact successfully to another person, maybe with the goal of developing and maintaining intimacy or a relationship, and develop respect and tolerance for the other person. Okay, so that's your social wellness. Emotional. Okay, so emotional pertains to a person's ability to manage stress and to express their emotions appropriately. So you might be surprised that there are persons who have difficulty in expressing what they feel. So they're having a battle with themselves on how to properly choose the right words to convey how do they feel. Okay, so that's the ability to express their emotion. Okay, and emotional wellness, generally speaking, involves your ability to recognize, accept, and express your own feelings. Okay. And then you have intellectual. So when we talk about intellectual, that's your ability to learn, okay? Ability to obtain knowledge, okay? And not just that, but use them or use this information effectively, okay? For maybe personal, familial, and career development, okay? So the intellectual dimension of wellness doesn't only stop with obtaining knowledge or your ability to learn, okay? So you need that, or you need to take into consideration that this knowledge that you have obtained is translated into its proper use. Okay. Next, spiritual. So when we say spiritual, so this, or spiritual wellness, this is a belief in some force that serves to unite human beings and provide meaning and purpose in life. Say, for example, some force here, the term some force here may pertain to nature, okay? So may pertain to science, may pertain to religion, or a higher being with greater power than only this particular person knows of. Okay? And then you have occupational. So when we say occupational, this is the ability to achieve a balance between your work and leisure. Okay, so nowadays that's a very popular thing that a worker or a person has to achieve in order to be satisfied with their lives. So being able to maintain a work-life balance. Okay, so employment and home influence your, or the environment at home and the environment at your job or at your work, influence the person's personal satisfaction and relationship with other people. Okay, and then you have lastly the environmental. Okay, so when you say environmental, being able to promote health measures that improve your standard of living and your quality of life. Okay, so these are the different dimensions of illness. Of wellness. So we're done discussing health and wellness. So it's about time that we proceed with illness. Okay, so when we say illness, it is not actually synonymously pertaining to having a disease. Okay? Why? Because an illness may or may not be related to a disease. Okay? Because again, just like wellness, only a person can say and describe that he or she is ill. Okay? So what is illness? As I mentioned, it's a highly personal state. Okay, so the person's dimensions of wellness a while ago. Okay, so the functioning of these dimensions of wellness is diminished, resulting into illness. Okay, now a disease, on the contrary, no, is an alteration in body function. Okay, so ibig sabihin there is a reduction, maybe a decrease in the capacity or the capability or shortening of a normal lifespan. Okay, so traditionally, when we say a person has a disease, no, it requires an intervention by your primary care provider. Okay, and the goal of the medical practitioners or the doctors is to eliminate or ameliorate the disease process. Okay, so how do they do that? So we need to find what is causing the disease. Okay, and when we talk about finding or identifying the causation of the disease, this is called your etiology. Okay, saan ba nag-umpisa yung disease na mayroon ka? Okay, so how did it start? Okay, so these are the things for which we have to consider when we talk about the disease and how it differs from having an illness. Okay, now, there are two types of illness. It may be acute in nature or may be chronic in nature. Okay, so when we say acute illness, okay, this is characterized by severe, sobrang malalang symptoms, but are of relative short duration. So you only experience it for like say around 5 minutes, sobrang sakit ng ulo mo. Okay, so that's an acute illness. So here, symptoms often appear abruptly. Abruptly meaning sudden. Okay, and eventually they subside really quick. Okay, kumbaga parang sa common lay or sa lay description nyo, easy come, easy go. Okay, so that's an acute illness. May or may not require intervention by healthcare professionals. Okay, so that is an acute illness. Okay, when we say naman chronic, okay, it lasts for an extended period. Okay, so how do we differentiate chronic from acute illness? Okay, by definition, when we say if you are feeling this kind of symptom in less than 6 months, okay, that is considered acute illness. But if you are experiencing this kind of symptom for more than 6 months, then that is considered chronic. Okay, so chronic illness usually has a slow onset, mabagal. Okay, so from as very minimal intensity of pain, nagpo-progress siya ng hanggang tumatagal, lalo siyang sumasakit. Okay? It often has periods of remissions and exacerbations. What does it mean when we say remission? Minsan nawawala. Okay? And exacerbation minsan mas lumalala. Okay? And then the care includes promoting independence, sense of control, and wellness. Why? Because like say for example for a patient with cancer, pain is too much. Pain is unbearable. Okay? So, the goal of care for patients like this who are experiencing this kind of illness is that to promote independence. Okay? Why? Because only this particular type of clients can experience this particular type of pain and can know how to alleviate this type of pain that they are experiencing. Okay? So, it gives them also the sense of control over their illness and their signs and symptoms. Okay? So, these are the two different types of illness. Okay. Now, according to Parson, there are 4 aspects of the sick rule. Okay. So, these are the things that a client is responsible of and are obligated to do or perform. Okay. So, when a person is sick, okay, we do not hold them responsible for their condition. So, you do not blame them like, ay, kasalanan mo kasi yan, kaya ka may sakit ngayon. No. Okay? So the mere fact that the client had the courage to consult a health practitioner, that is already something. And that is already taking responsibility of his condition. Okay? So do not tell or do not say, even if it's an obvious thing to say, no? So do not tell the patient or do not blame the patient for having this kind of disease. Okay? Clients are not excused from certain social roles and tasks. Okay? So kahit even if the patient is sick or ill at the moment, there are still tasks that he needs to do or to perform. Okay? And clients are obligated to try to get well as quickly as possible. Meaning, do as a patient, taking responsibility for your health and you consulted a physician, you give it as much as possible the effort, no, to try to get well and recover as quickly as possible. Okay? And clients or their families are obligated to seek competent help. Okay, so that's why maybe clients and their families are obligated to seek competent help. Okay, so maybe you would be encountering in the future that there are, like say, there is a patient who has this particular kind of disease, consulted a particular physician, no? And they opted to get another consultant or to get a second opinion, okay? Because they believe maybe this practitioner is much experienced compared to that of the first physician that they had consulted to, okay? So these are the 4 aspects of the sick role according to Parson. Okay. All right. Okay. So to understand a person or a patient, okay, so you might be interested in identifying are there different stages of illness, and you might be surprised that if you are experiencing any symptom or of anything, you might be surprised that, yeah, I'm actually doing that. I do actually experience that. Okay, so I'm guilty of that. Okay, so there are different stages of illness according to Sackman. Number 1 would be symptom experience. Okay, so under symptom experience, a person who is ill believes something is wrong within them. Like, say, for example, when you woke up in the morning and then you say, parang ang init ng pakiramdam ko. Okay, parang may mali. Okay, so there are instances that a client may respond emotionally. Like, or kapag may nararamdaman ka, ayaw mong kumilos. Okay, ayaw mong tumayo sa pagkakahiga. Okay? So, you believe something is wrong with you. Okay? So, that's symptom experience. Parang nahihirapan ako huminga. Parang ang init ng pakiramdam ko. Okay? So, that's symptom experience. Number 2. Number 2 is the assumption of the sick role. So, under the assumption of the sick role, the client who is ill accepts the sick role and seeks confirmation. Okay? So, when you try to seek confirmation, if you are thinking that you have fever, okay, maybe you find a thermometer and then you check your temperature yourself. Okay, so that's how you seek confirmation. Okay, or some instances, maybe majority of you are guilty of this, no? Mami, parang ayokong pumasok. Parang init yung pakiramdam ko. Tingnan mo nga, mami. Kaya baka mo nga po ako dito. And, okay, so you seek confirmation. Okay, at this point also, no, if you tell your mother that you are not feeling well, or maybe mainit ang iyong pakiramdam, your mother would say, oh sige, uminom ka ng 𝑰𝒍𝒍𝒏. Okay? Yeah, promote pa tayo. Okay? So we call that self-medication or self-treatment. Okay? So, assumption of the sick role, you accept that you are sick, you seek confirmation, okay? And you do self-medication. Okay? Now, if by chance this self-medication doesn't lead to relief of the symptom experience or the illness experience, no? That's the time you do medical care contact. Okay, so you consult for help. You seek a health practitioner or a health professional for help. Okay, so like say for example for me, since I am a nurse, no, and if my kids are sick, or like say inuubo or sinisipon sila, so I know how to provide relief from this, no. But if by chance may ubo at may sipon na tumatagal na ng 1 linggo, mahigit 2 linggo, and nag-umpisa ng lagnatin yung anak ko, okay, so that's the time I consult our pediatrician and ask for their opinion on this, and maybe to ask for, let's say, prescribed medications. So that's medical care contact. Okay, so if you consult a health practitioner, no, you would give your doctor would give you their plan of care, no, to provide relief from the symptom that you are experiencing. Maybe, sige, ito yung mga gamot mo, ito yung inamin mo, ito yung mga bagay na dapat mong kainin, ito yung mga bagay na huwag mo munang kakainin for the time being. Okay, so that is medical care contact. Okay, now, since nagpa-check up ka, no, you brought yourself to a medical practitioner, you now accept the dependent client role. Okay, so you accept the diagnosis of your physician, and you are definitely required to follow the prescribed treatment for you to, say, have a relief from the symptoms that you are experiencing. So you now become dependent on the health practitioner for help. Okay, so if the doctor says, oh, you take this medication for 7 days, okay, so you are required and you are dependent on the doctor's order. So that is number 4, dependent client role. And then lastly, we have recovery and rehabilitation. So after some time of following the full treatment regimen or the full treatment plan of your physician, no, you now resume to your former roles and responsibility. Okay? You give up the dependent role, and maybe if, like say, during the time that you were ill, no, hindi ka pumasok kasi nilalagnat ka, no, by this time, no, you can return to your normal activity, go to class, no. So, perform your responsibilities. So, these are the stages of illness according to Sakman. Now, there are different impact or the effect of illness to the client and the family member to which the client belongs. Okay, now let us discuss them one by one. Number one is that there are behavioral and emotional changes. Okay, let's say for example, the first time maybe a client is diagnosed of having cancer, maybe a client would be in denial. Okay, by being in denial means, no, you are having emotional outbursts, no, you try to throw the emotions towards the other members of the family by being rude at times. Okay. And there are emotional changes, maybe sudden outbursts of emotions or crying. Okay, so these are things that we can observe to a client, no, as an impact of having an illness. Number two, you have loss of autonomy. When you say autonomy, no, being able to perform your task or anything alone, okay, on your own. Now, if by chance a client was diagnosed or had an accident, okay, that maybe injured his or her foot, and that would mean requiring to amputate, putulin yung paa, okay, then eventually this had an impact on the autonomy of a person, no? They can no longer walk alone without assistance, okay? Next would be self-concept and body image changes. Okay. One good example could be, let's say, a person who was maybe the head of the family, who is the breadwinner, who provides for the needs of the family, suddenly had a stroke, okay? And then eventually they become paralyzed, no? Their self-concept and their body image are greatly affected, okay? They would feel that they are useless. They would feel that they are pabigat, okay? All the more additional burden to the financial needs of the family, okay? And lifestyle changes. Okay, let's say for example, if you are diagnosed with diabetes, and before you were diagnosed, your usual diet would involve maybe 3 times a day of dining at a fast food center. Okay, so now if you are diagnosed with diabetes, you need to adjust your diet. Okay, so you need to have, from a sedentary lifestyle, you would need to have an active lifestyle. Okay, so these things are what do we considered as having great impact as brought about by having an illness or a disease on the client. Okay, now let us talk about the impact of the illness to the family to which the patient belongs. Okay, number one could be role changes. As I mentioned a while ago, it could be that the sick person and the family is the breadwinner. Okay, maybe the father, for example. Okay, and then suddenly the father becomes ill and can no longer perform his task of providing the needs of the family. So maybe the mother now takes the provider role of the family, or maybe if the mother cannot provide because he or she has to take care of the father, maybe the eldest child now takes the role of the breadwinner. Okay, now there are task reassignments as mentioned in relation to role changes, no? Task reassignments now becomes, like say, the second or the eldest female member of the family, or the female sibling, no, now becomes, let's say, the one who prepares the food, irons the clothes, washes the dishes, washes the clothes, ayan. Okay, so there are task reassignments. Okay, there is an increased demand on time. Okay, so definitely, no, if you need to take on different roles, okay, or if you need to take on the role of the sick member of the family, that would entail, no, a portion or maybe a big portion of your time compared to that of your regular routine than during that time, or compared during the time when this particular family is not sick. Okay, anxiety about the outcomes. What does it mean? Okay, like say for example, the client had a stroke, or a family member had a stroke, okay, or maybe a family member had an accident, a vehicular accident, and was on comatose. Okay, so when a person is comatose, like say for about 2 to 3 days, the family member now becomes anxious, no? When you say anxious, when you say you're having anxiety, you are fearing the unknown. Okay? Because you are not sure of what might happen the following day or the next day. Okay? So, anxiety of the family members about the outcome of the particular condition at the moment. Okay? Conflict about unaccustomed responsibility. So, in relation to role changes, okay, and past reassignments, there might be instances like the person who took on the role of the sick family member might feel at times be overwhelmed with the responsibility that was put on his or her shoulder. Okay? Then it can, no? It can lead to sudden outburst of emotions, no? Okay? So pwedeng mag-away-away. Okay? Then you have financial problems. So definitely, no? Again, if that's the breadwinner, and then someone has to take the role, or maybe kung maliliit pa yung mga anak, no? Definitely, it would lead to financial problems. Okay? Loneliness as a result of separation and pending loss. Okay? So, ibig sabihin, there is this feeling, there is this emotion of loneliness because of the possibility that maybe in the next few days, no, we might not be having this particular patient or family member around anymore because of the influence or the impact of the disease. And there could be change in social customs. So the things that you are used to when everything was in normal, maybe you were like, you were wealthy during the time when this particular family member is working, but then all of a sudden, no, because of this particular illness, you're having now eventually financial problems. Okay, you might a family member or a child maybe would need to be employed as a, say, a working student, or maybe to give up his or her own education so that he or she can provide for the needs of the family. Okay, so the impact of the illness, no, depends largely on, number one, which member of the family is ill, okay, the seriousness and the length of illness, okay, and the cultural and social customs the family follows. Okay, so these are the things that we need to consider, no, as potential nurses in the future, or as student nurses who are trying to become the best possible nurse that they could be in the future. So a better understanding of the interaction of health, wellness, illness, and the different factors that affects this tree is very much essential. So this will be the end of our discussion for today. And please be ready with our graded recitation, and please join our face-to-face discussion. Thank you.